That little pressure right behind your brow. How do you know if it's a migraine gearing up or the whisper of your pineal stirring awake? How do you stop yourself from panic spiritualizing pain or from dismissing a real physical problem as just energy? By the end of this guide, you'll have a simple, safe 3-step test you can use in minutes, practical signs to read in the body, and a clear set of red flags that demand medical attention. Quick but important note before we start. This video is experiential and educational, not medical advice. If you ever feel a sudden, severe headache unlike anything you've felt before, sudden loss of vision, weakness or numbness on one side of the body, difficulty speaking, fainting, seizures, or confusion, seek emergency medical care immediately. Stop any practice if you feel lightheaded, dizzy, nauseated, or if the pain dramatically worsens. This protocol is a gentle sensory test, small, reversible, and safe when done with care. Imagine a locked door in the middle of your forehead. Sometimes that door creaks because of tension, dehydration, or a sinus building pressure inside. Other times someone knocks from the inside, an inner signal, soft and strange, that something subtle is shifting. People make 2 mistakes. They either assume every knock is a crisis, or they declare every creak to be a spiritual awakening. Both errors cost you calm, and one of them can cost you your health. Why is this confusing? Because many sensations overlap. A throbbing temple, a dull pressure behind the eyes, a brief flash of light. Any of these can be migraine, eye strain, sinus pressure, or something you might describe as a pineal activation. Culture and curiosity push us toward mystical explanations. Fatigue and caffeine withdrawal push us toward clinical ones. The skill we'll cultivate is simple discernment, careful observation, neutral attention, and a tiny intentional probe to test how the sensation behaves. First, let's sketch the practical signs you can use as a diagnostic map. 2 clear columns in your mind: physical headache indicators and pineal energetic activation indicators. These aren't absolute rules, but patterns to guide you. Physical headache indicators. Quality, often throbbing, sharp, or heavily pressure-like, can feel like it comes from muscles, sinuses, or the blood vessels. Context, triggers, worse with movement, bending forward, or physical exertion, linked to dehydration, missed meals, strong caffeine changes, poor sleep, or long screen time. Accompanying symptoms: nausea, vomiting, sensitivity to bright light or loud sound, a sense of fogginess. Sometimes one-sided weakness or visual aura that precedes or follows the pain. Behavior with touch and movement often worsens with neck movement, jaw clenching, or pressing on temples and scalp. Time course can escalate into a persistent, growing pain without intervention. Energetic, pineal activation indicators. Quality. Subtle pressure or gentle pulsing centered deep behind the forehead, like a quiet thrum rather than a sharp ache. Some describe a soft internal light, ringing, or a feeling of inner spaciousness. Context, triggers. Commonly appears during meditation, moments of sudden silence, lying down to rest, or after long periods of inward attention. May coincide with a calm breath or a shift into non-reactive attention. Accompanying impressions. Brief, intermittent visual microflashes when eyes are closed. A sense of presence that's neutral rather than panicky. A fleeting clarity or feeling of depth rather than nausea. Behavior with attention. Often shifts, spreads, or settles when met with calm, non-reactive observation. It may become quieter or resolve if you gently redirect attention. Time course can appear as a short-lived event or integrate over hours or days, leaving a gentle afterglow of clarity or neutrality. Now the overlap and the traps. Sinus pressure can feel like pineal pressure. Eye strain can create tiny flashes that look like inner light. Medications or withdrawal can produce both headaches and auditory ringing. That's why we don't rely on a single sign. We observe multiple features and then we run a tiny low-risk experiment. Here is the 3-step test adapted from older metaphors: recognition, authority, command. translated into safe, modern language you can use right now. This is the core of this video. Each step is short. Keep it gentle, seated with your back supported, and stop if anything worsens. Step 1. Scan, recognition. 20-30 seconds. Sit comfortably with your back supported and feet on the floor. Close your eyes if that helps you notice. Keep your breathing natural and comfortable. Do a grounded scan. Name exactly where you feel the sensation. Is it directly behind the bridge of your nose, across the temples, behind the eyes, or along the scalp? Describe its quality aloud or in your mind. Pressure, pulsing, sharp, dull, burning, cool, warm. Note how long it's been there and what you were doing before it started. This is not analysis, just descriptive observation. If you also have nausea, vomiting, visual loss, fainting, or numbness, stop now and seek medical help. Step 2. Receive, authority, non-reactivity, 30-40 seconds. This step trains a neutral relationship to the sensation. Maintain a natural breath. If it feels comfortable, make your exhale a hair longer than the inhale. Something simple like 4 in, 4 out, or 4 in, 6 out, if that feels soothing, never forceful. The key is calm authority. You are not begging the body to change, and you are not forcing it. You are the steady witness. Soften around the feeling. Instead of tightening, relax the jaw. Drop tension from the shoulders, and let your belly soften. Watch the sensation without amplifying it with fear. Keep noticing detail. Has the pressure brightened, dimmed, spread, or drifted inward? Step 3. Intend. Gentle command, probe, 20-30 seconds. With a quiet, low inner phrase, aloud only if comfortable, say something like, I observe, or I notice, or open. You can even whisper it, but keep it soft and simple. Bring attention deliberately to the center of the sensation for about 10-20 seconds. This isn't a shout. It's a controlled, curious probe. Observe what happens. Does the sensation dissolve into space or shift into a gentle vibration? Does it intensify, become sharp, or spread? Make a mental note of direction and tone. If, during any step, you feel lightheaded, dizzy, nauseated, the pain intensifies significantly, or you experience any of the red flag symptoms mentioned earlier, stop immediately and seek medical care. After the 3 steps, reorient your body. Open your eyes if they were closed, wiggle your fingers and toes, take a few grounded breaths, and stretch your neck gently. This simple physical action grounds you, making sensations easier to interpret. Now, how do you read the results? There are practical patterns that tend to emerge. Signs leaning toward energetic, pineal activation. The sensation shifts into a soft, even vibration, or a gentle pulsing, centered behind the forehead, often accompanied by brief internal visuals, tiny flashes or like static light with eyes closed. The feeling eases under neutral observation. It doesn't spike when you look at it. You experience a subtle sense of spaciousness, mild ringing that is not loud or distressing, or a gentle settling after the probe. Any discomfort remains mild, and you feel alert, clear, or neutral rather than nauseous or disoriented. Signs leaning toward a physical headache. The sensation intensifies when you focus on it and doesn't soften with neutral attention. The pain feels sharp, radiates to the jaw, neck, or one side of the head, or comes with nausea, vomiting, or sensitivity to light and sound. Movement or changes in posture make it worse. The pain persists or grows rather than fades. You experience vision changes, not just brief small flashes, or any focal neurological signs such as weakness or numbness. There are intermediate outcomes to expect too, things that require patience rather than an instant judgment. Think in terms of latency. Not every activation resolves immediately. You might find echo, a brief reverberation following the probe, subtle after sensations that come and go over minutes or hours. This often feels like harmless residual vibration or a lightness behind the brow. Collapse. a sensation that relaxes and settles downward into the body, leaving less intensity but a mild tiredness. This can be restorative, but if it's accompanied by headache escalation, be cautious. Neutrality. The sensation loses its emotional charge and becomes an unremarkable background hum. Neutrality is often the sign of healthy integration. If nothing changes in the first minute, give it time. Track it. Sometimes subtle events unfold over hours or even the next day. Keep a brief log. Write the time, location, behind the eyes, temples, crown, quality, pressure, pulse, ache, triggers, meditation, lying down, camera glare, duration, what changed when you did the test, and whether there were any added symptoms like nausea or visual disturbances. Let me emphasize a few practical confounders to rule out because they are common culprits. Sinus congestion and allergies produce deep forehead pressure and change with bending forward. Eye strain and uncorrected vision or long screen time produce frontal ache and occasional visual artifacts. Neck and jaw tension, TMJ, can refer pain to the forehead. Dehydration, low blood sugar, and caffeine withdrawal cause throbbing headaches and irritability. Medication side effects or recent changes in prescriptions can also produce head sensations. Simple steps to reduce false positives before you conclude: activation. Drink a glass of water and wait 10-20 minutes. Check posture. Sit up tall, roll your shoulders, relax your jaw. Blink and look at distant objects for a minute to relieve eye strain. Rest in a dim room for 10 minutes, not forcing anything. If the sensation eases with these, it was likely a physical confounder. Safety rules and red flags. You must take these seriously. Seek emergency help for sudden, severe headache that peaks quickly, often described as thunderclap pain. Seek help for new weakness, slurred speech, confusion, fainting, persistent vomiting, or loss of vision. These are signs of potential neurological emergencies. If the sensation is accompanied by a high fever, stiff neck, or confusion, seek immediate medical care. If after repeated self-tests the pain consistently worsens with any probe or the changes are unpredictable and alarming, see a healthcare professional. A few practical scripts and prompts you can use during the test. Pick the ones that feel most natural. For recognition. Where is this? Pressure at the bridge or at the center behind the brow? Sharp, dull, or pulsing? For authority, non-reactivity. I'm watching. I do not amplify. I let this be as it is. For gentle command, I notice, I observe, I allow. Use any of these quietly for 10-20 seconds. Make the practice reversible and repeatable. If you want to test again later, wait at least 30 minutes to give the system a chance to settle, and make sure you're hydrated and physically settled. Avoid doing this test if you are driving or operating machinery. What about the language of myth and metaphor? The old stories that call this the third eye, or speak of a monad, archontes, or a demiurge. Those are powerful symbolic tools. Use them as poetic frames to orient attention, but don't let metaphor override bodily signals. Think of mythic language like a map legend. It can help point you toward experience, but the road signs, your pulse, nausea, vision, are the ones you must obey. A short journaling template you can copy down after testing. Time. What I was doing before it started. Location of the sensation. Quality. Pressure. Pulse. Sharp. Dull. Light. Accompanying symptoms. What changed during step 1? Scan. What changed during step 2? Receive. What changed during step 3? Intend. Outcome. Eased. Shifted into vibration. Intensified. No change. Follow-up action taken. Hydrate. Rest. Seek care. Keeping a record even for a few days trains you to see patterns. Do certain practices reliably produce the sensation? Is it linked to caffeine or lack of sleep? The pattern is often more useful than a single event. A few integration tips for a safer, steadier practice. Build a routine. Short meditations no longer than 10-15 minutes at first, in a quiet space, after attending to hydration and posture. Avoid vigorous breathwork or techniques that leave you lightheaded. This test asks for neutral breath and calm attention, not extremes. Practice gentle neck stretches and eye breaks if you're on screens a lot. Sleep and nutrition matter. Regular sleep cycles reduce false alarms. If you're doing a longer contemplative practice, pause every 10-15 minutes to check posture and open your eyes for a minute. Let's come back to the heart of the matter. Why cultivate this skill? Because curiosity without clarity leads to either needless worry or premature spiritualization. Discernment creates freedom. When you can tell whether something is bodily and treatable or subtle and worth integration, you can respond with wisdom, hydrate, rest, and see a doctor if needed. Or, if the signs suggest subtle activation, attend to it with non-reactive curiosity, journaling, moderate practice, and patience. Short practical example to anchor this. You're sitting in meditation and notice a soft pulsing behind the forehead. You run the test. After the scan, you find it's exactly midline and feels more like vibration than ache. During receive, your breath stays steady and the sensation softens. During intend, you say, "I notice." And the pulse shifts into a gentle ringing for a few seconds and then dwindles. You make a log entry. You hydrate and sleep well that night. Later that week, the sensation returns only briefly during focused silence and leaves a mild sense of clarity. That pattern, transient, shifting, improved by neutral attention, is consistent with an energetic sign rather than a clinical headache. Conversely, if the sensation had grown sharper, made you sick, and worsened with movement, you would have stopped and sought care. A final note about authority. The authority in this test is not about commanding the cosmos. It's about the steady presence of your attention. Calm, confident, non-reactive. Think of it like a lighthouse rather than a blaring horn. The oldest metaphors spoke about a wakeful center calling from within. Translated into practice today, that center is simply neutral observation, steady breath, and gentle intention. Now try the 3-step test for yourself. Do it seated, supported, and safe. If this message landed with you, do the micro-test and drop one short comment. Write pulse if you felt a pulsing change, or no if nothing shifted. That single word helps the community learn together without clutter. Remember to be careful. Stop if the pain increases or if you experience any red flag symptom. Respect your body and your curiosity equally. Honor the simple wisdom of care. Hydrate, sleep, check posture, and when in doubt, consult a professional. If you found this useful and want more grounded guides to subtle experience, practical, safe, and respectful, subscribe and explore the next video where we walk through safe daily practices to cultivate inner sensitivity without triggering false alarms. You don't have to choose between fear and fantasy. With patient attention, simple tests, and common sense safety, you can tell the difference between a headache and a subtle inner activation, and meet both with the right response.